Welcome to H&HN Daily's Healthcare Quality Improvement Series. I'm Haydn Bush, Senior Online Editor for Hospitals and Health Networks magazine, and I'm joined today by Tina Spector, Vice President of Quality, Patient Safety, and Disease Management for Mount Sinai Hospital in Chicago. Tina, thanks for joining me today.
Very nice to be here.
So Tina, I understand that Mount Sinai has been involved recently in some pretty interesting work around the patient discharge process.
About a year ago, we had an interdisciplinary team of senior leaders and medical staff that got together to begin assessing where Sinai was in terms of readmissions, really in response to what we knew was coming in terms of healthcare reform. And we really needed to find a model that would be easy for us to implement. And because we're a safety net hospital, we were looking for something that would not require a lot of additional resources. We were contacted by the National Association of Public Health Hospitals and Joint Commission Resources asking us if we would be interested in joining this Project RED project that is funded by the HRQ, and we decided to go ahead, take a look, and joined. The project involves hiring or putting in place a nurse who serves as a discharge coordinator. And we were able to do that taking an existing member of the quality team, somebody who had already been focusing on heart failure core measures, management, and measurement. And it involves identifying patients at the beginning of the stay, working with the patients to increase their knowledge and to actually begin providing them education around taking more responsibility for their disease. We found through doing these activities that we're able to very, very significantly reduce the rate of related heart failure readmissions to Sinai and also the rate of unrelated readmissions to Sinai as well.
And that's an increasingly important issue with all the reimbursement pressure around readmissions. So this was really a holistic, not just the discharge, but also the disease management that followed.
Yes, I would, and I think holistic is a great way of looking at it, because during the stay and then after the stay, we certainly had the pharmacist involved, but we also had any kind of physical therapy involved. We had nutritional counseling that would be done, and then also if we identified patients that were at risk at home for, let's say, not having adequate resources to purchase food or even having working telephones or stoves, we would send in Sinai's community services to do home assessments.
So this also kind of fits into the overall trend we're seeing in healthcare, where there's a push to kind of treat patients in the community and see the acute care setting as just part of that, but kind of treat patients no matter where they are.
Right. It's really about a seamless patient care experience across the continuum of care. And because of our excellent results, Sinai's leadership has also funded additional positions for this coming year. We're going to be adding, hiring this individual, actually moving her into a permanent position as a disease manager, and we're going to also be adding a couple of more nurses to serve in those roles, and then we'll be also bringing forth or hiring some disease navigators, so folks that can help patients really navigate the healthcare system. They're almost extenders to the disease management nurses. So we'll be able to expand this to our population.
Well, Tina, that's all the time we have for today. Thanks so much for joining us today.
Thank you so much for having me.